Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast of the Common Sense MD. Today I have a really special guest here, Dr. Randy Martin, and he is the owner and operator of Heartland Pharmacy, which we've moved in next door, which is incredible here in Knoxville. Our new office is on Kingston Pike, right beside you.
Yep.
So it's very fortuitous of us because I've used compounding pharmacists for my whole career. And, you know, the more you do functional integrated medicine, the more we need compounding pharmacies. If you follow my blogs, you'll see that I pulled an article from the Wall Street Journal a couple weeks ago, which I don't know if I sent to you or not, but it was talking about how compounding pharmacists have pulled our medical system out of the fire because of all the drug shortages and all the stuff that you do. So Mayo Clinic uses you guys. I mean, all the big clinics use compounding pharmacists. And certainly we've known each other for years, and you do such a good job. I feel very safe when you are making medications for us, for our patients. And tell me a little bit about your career. How'd you get in from being a pharmacist to a compounding pharmacist?
Sure. So I started a pharmacy career. I graduated in 2010 from the University of Tennessee. I started, first job was a manager at Kroger, and I was there for about 7 years. Then I went to Ingalls, managed there for a couple more years. And I noticed over the years, 8 years plus, all the patients that were coming in, we were treating them, or I thought we were treating them, but none of them actually got better. We were just putting a Band-Aid on a lot of their issues. And I wanted more, and I wanted to kind of get out and be able to practice on my own and do what I felt like the patients needed and not be stuck under the corporate confines. And so I kind of branched out. I've got a few jobs at independent places wherever I could find a job, quit corporate, and kind of went out. And I got lucky. I actually got a phone call one day because one of my friends had turned down the job that I currently have because she was happy where she was at. So I went in, interviewed. It was great. And since then, I've found my calling. It's exactly what I want to do, and I love it. I get to interact with patients the way that I want to, take care of them, listen to their problems, take as much time as I need. And we really get to find the root cause of what's going on, and I think that's important and what's missing in a lot of medicine today.
And that's very unusual for a pharmacist because, in general, pharmacists have turned into medicine dispensers, don't you think? I think doctors have turned into prescription writers, pharmacists into dispensation only. You know,
It really is, and really you kind of feel like you're just in an assembly line in that type of business, and it takes the fun out of it and the joy of being able to help somebody because it's more just a time crunch and following all these guidelines, the workflow, and you got to kind of stay in it. And it just wasn't where I wanted to be.
I'm glad you're here. You know, the pharmacist and doctor should always work together. Sometimes the pharmacist has a lot more time with the patient. You know, in my type of practice, I have plenty of time with my patients, but in most practices, not. You know, the way that our medical system's going, it's more cookbook, throw a medicine at somebody, they don't get better, who cares? The pharmaceutical companies made money. Everybody's happy. The patient wanted a pill, they got a pill.
Yeah, and then sometimes even if the pill didn't work, they stay on it. They never take them off of it. And I just see that happen. And you get patients on 8, 12 medications, and they don't even know what they're treating anymore. And it gets it's kind of sad.
I agree. I probably spent the first half of my career writing prescriptions. Now I'm trying to get the patients off of prescription medicines as much as possible. Although, you know, we need medications. I mean, there's no doubt that with all the technology and all the great medications out there, you need medicine. So you don't need to be totally on one side of the fence or the other. You need a blend. That's what performance medicine is, really a blend between traditional and alternative holistic medicine. And by holistic, I mean you're looking at the whole person, not just one thing that they've come in with. But so you had this extra training with compounding pharmacy. You like medications that are individualized, and you're able to make not only hormones or pain creams. What are some of the things that you do? Give me a
Sure.
roundabout.
So hormones is one big thing. We do a lot of bioidentical hormones. We do low dose naltrexone, which I know you're very familiar with. We do a lot of thyroid treatment. We can actually use a T4, T3, which anybody with thyroid issues is going to be familiar with. But we can also compound the desiccated thyroid as well. Some people use Armor, some people use NP, but they're usually in like 15 or 30 milligram increments. Some patients need to be in between, so we can customize that. We actually do a lot of pet and vet meds as well, so that's very custom, and we kind of make that for each individual patient. I mean, we make it very specific for the dosing that they need. We take care of patients that let's say they have a gluten allergy or lactose issues, any type of allergies. We can take care of those patients, even if it's a normal medication, like for blood pressure. We have some people like that just can't take what's mass produced because they have issues with it.
Or can't swallow a pill. You can make it liquid.
Absolutely.
And a lot of your pain gels really work for pain without putting somebody on a systemic oral pain medicine that's going to take their...
Absolutely. Side effects go down drastically when we apply it topically, for sure.
A lot of people don't understand bioidentical hormones at all. Most doctors really haven't even been exposed to it, but it's a whole new world, and it's a great world.
Yeah, and honestly, when I was practicing in retail, I didn't know that much. They didn't teach me much in school. It's kind of just something that I had a passion about, and just took on that endeavor myself and learned because I wanted to know more.
And you were one of the ones that really pulled us out of the fire here in the Knoxville area by helping us get ivermectin for people that really needed it for COVID.
Absolutely.
And what a change in attitude about ivermectin now. Literally, I probably couldn't even say that word and not get censored a year or two ago.
I didn't say the word because I was afraid to.
Yeah, I used a code word for it. But now, I mean, they've seen the studies. It works. It's safe. It's something we've used for many, many years. It got the Nobel Prize. But for some reason, they trashed it as a horse medicine, during COVID, and you couldn't even say the word without getting censored. I got thrown off many platforms many times just by using that word. So now, fortunately, we live in a state of Tennessee that now you can get it over the counter.
Yep. Absolutely.
And even all the studies are acknowledging that it is helpful for COVID as well as many other things. So. You have to kind of, in medicine these days, you have to kind of think for yourself a little bit. And if you bought the narrative of what went on during COVID, then, you were hurting.
Yeah. Oh, yeah. We had a lot of people that they would follow. I had a dentist come in one day. He went 9 months. He couldn't even play with his kids. He couldn't walk up and down the stairs. He had gotten, I believe he had a vaccine injury, and he had taken it, and he was struggling for so long, and finally he's like, I try to follow medicine, what they recommend. He's like, I'm just going to try it, and within 3 days, he had his life back. And it was incredible to hear his story. He called me every day for a week to thank me. So,
on a completely safe medicine, they were denying use of this. It's just crazy, our medical world now. So anyway, so take it with a grain of salt what you do. Here brings up another controversial topic that I want to address with you.
Sure.
We do a lot of weight loss stuff because really, in my opinion, obesity is our country's #1 medical problem.
Absolutely.
By far.
The metabolic syndrome that comes along with it, absolutely.
I mean, people, when I grew up back in the 60s, you didn't see obese people like you do now. And now it's 2/3 of us are obese. So now we've got a revolutionary type of medication called an incretin that works in natural ways. And it's just, to me, the drugs of the century that I've seen since I've been practicing medicine. And a lot of people kind of are demonizing it, saying, well, you don't need to use Ozempic or Mounjaro. You just need to tell them to eat less and exercise more. But guess what? That doesn't work. It's extremely complex, as are these medications. But
yeah, so in my experience, well, we can start by saying GLP-1 or semaglutide or anything that's similar, the GLP-1 is actually something your body naturally produces. So we're making the semaglutide it's just mimicking that structure. So it's not like we're doing something that's completely changing your physiology. So, but yeah, we've seen so many patients like 8 to 10 pounds a month. It's not like it's making you lose weight super quick. It's not dangerous, but they do really well, and I mean, they were so happy. Like they come in, and you can just see it on their face, and they're like, "This is what I've been trying to do for 20 years. I've tried 100 different diets. I've tried working out, but with metabolic syndrome, I mean, that system's broken." And this actually kind of helps override some of those signals and stuff that these people aren't producing like they should be to send like I'm full. That system's broken. Well, this kind of overrides that and allows them to be able to do that again and kind of control what they're eating.
It's truly revolutionary in the way we're able to practice medicine with obesity. You know, it's a diabetic drug, but they notice that these diabetics are losing a ton of weight. They don't need their medications anymore. It's really changed their life, which it has. I've never seen a medicine that works so well for obesity. It's really made the normal doctors in the medical establishment realize that obesity is a metabolic disease. I mean, it's a chronic metabolic disease. It's not that you're eating too much. You know, obese people in the past were thought of as lazy, or, you know, they just didn't know what to do. They didn't exercise. They just ate fat all the time, which it totally revolutionized how we look at obesity. Really, it's a metabolic thing. It's not really, it has nothing to do with your personality or anything.
It doesn't.
And some people are more predisposed to it. It's a hormonal, genetic, metabolic disease.
I think so. And unfortunately, I think a lot of it is just the way some of these synthetic foods, I think they can kind of disrupt a lot of issues through the gut. You know, all these processed foods with words you can't even pronounce on the back of the can. And I think those have more detrimental effects than what we're led to believe.
I believe you're right. My son Andy, who you all know, went to Europe for a couple weeks, and he's a type 1 diabetic. He said he ate what he wanted. His sugars were completely normal. And when he got back to the United States, his eczema came back. You know, he felt his sugars were all over the place. We put a lot of stuff in here in our country that is illegal to put in the food in Europe.
I hear many stories. People travel out of the country and they're like, "Hey, I could eat gluten over there." And then I come back here and bam, within a day or two, they're sick again. It's pretty wild.
It's really scary, the country we live in. It's so great in a lot of ways, and yet in other ways, you know, it's kind of, you're at a disadvantage.
Yeah.
I mean, let's talk about semaglutide a little bit. So that's the buzzword now. What would your advice be on people? I know every weight loss clinic is, you know, using it. They'll have you come in and get a shot in their office for a week, and, you know, they charge you crazy amount for it, even though it's an expensive medicine. Tell me ways that are legal, that are safe to get around that.
Yeah, so it is an expensive medicine.
Because nobody's covering it unless you're a diabetic, and your insurance probably not going to cover it.
And even if they do cover it, it's hard to find because there's so much demand for it. But I think the big thing that people need to take into mind, like, you need to see somebody that knows what they're doing when they're prescribing it. When you go to some of these weight loss clinics that I've seen, you just go in, you get a shot, you go home. They don't test you for gut issues. They don't see if you're having stomach pain or if you're constipated for 7 days. Like, that's issues that maybe you shouldn't be on semaglutide, or we can do some supplements to help prevent that, because you don't want to come out worse than what you were when you started. The goal is to get better and healthier, which is very possible on semaglutide. It's incredible, but you got to make sure that you treat any underlying issues previously. And that's why somebody like Dr. Rogers or Robin Riddle or anybody in this functional medicine community, they understand that there's more than just taking this shot, losing weight, and that's all there is to it, because that's not always the case.
Because when they get off this medicine, they're going to gain the weight back.
Absolutely.
Unless they totally figure out their metabolism and what they're doing. Again, these medicines aren't to lose 5 or 10 pounds. That's maybe one reason there's a huge shortage of it. It's been called the Hollywood drug loss plan, but really for people with metabolism problems, they're almost all pre-diabetic, insulin resistant, and this is what that helps overcome. So, but those people need to stay on this medicine for a while.
Yeah,
if
and
not lifetime.
A lot of them do, and the few that and there are some that can come off of it, but it's important that those people are making lifestyle and dietary changes during this process, and that's why they're able to come off of it, because they're learning how to eat healthy and what to stay away from. And I think that's very important. And then we have some people that just don't want to make those changes, and they tend to be on it long term. That's just a choice that you got to make.
There's a lot of misinformation about dietary things that you can do, and the thing about it, everybody's different. I mean, it's not just like a cookbook formula.
No.
One size does not fit all. You need to figure out all your hormone levels, your thyroid, your adrenals. Vitamin D is a hormone. And as you know, when you take semaglutide, it's a gut function thing. You need to probably be taking amino acids and making sure you're not getting depleted or losing muscle with it. There's a lot of issues.
Absolutely, yeah. So with semaglutide, it's going to mimic that GLP-1, and that makes the body feel satiated or full. So a lot of times people aren't going to eat nearly as much, and typically a high nutrient food is going to cause GLP-1 to be produced naturally. Mm-hmm. So if we're not eating as much because we're overriding that system, it is a good idea to maybe take some multivitamins, or I like to use organ meat supplements. I use a supplement from I'm going blank.
Primal Kitchen, or use like a beef liver.
Heart and Soil.
Heart and Soil.
Capsule. Yeah.
Dr. Salandino.
Absolutely. Love those guys.
I have the same one.
But getting those nutrients, that's what our body needs in order to naturally produce that GLP-1. So if you're going to be overriding that system, just make sure you're getting plenty of nutrients in. I've heard people being concerned about muscle loss, which again, if you're not eating enough, make sure you're getting some branched chain amino acids in to kind of help sustain that muscle that you already have.
Protein and work out.
Absolutely, yeah, working out. And a big complaint I have from patients also is they're concerned about their skin getting saggy or losing some of the shape. So getting plenty of collagen is important, and you may be familiar with this too, but also a silica supplement, absolutely, right, to stimulate that collagen production. It's very important.
Yeah, and you have those in your pharmacy.
We do.
Don't you?
Yep.
Yeah, I'm a big believer in beef liver. I've done a podcast on it. I don't think there's not one food that's more healthy than beef liver.
I agree. Absolutely.
I mean, it really covers a lot of what you need in that one beef liver. Again, I swallow it whole, raw, fresh, grass-fed. And then I do use some of the Heart and Soil stuff too. I like that stuff because I can't get that fresh stuff every day.
Oh, yeah.
So I always use it as a backup. Very helpful for your gut as well.
Absolutely.
So there's a lot of things you need to think about with when you go you pick your medications up, and you start thinking about these other things you need to be doing that may be a little outside the box. And that's why I like compounding pharmacists. They think outside the box. They want to know why. And
yeah, exactly. I might kind of to expand on our point just a minute ago. I had a patient come in today, and she's like, well, I'm on this dose of semaglutide. I can't go up anymore because it makes me feel sick. And the dose she was on was the minimal dose. And she's like, I asked my prescriber, and they said, I don't know. I asked the pharmacist. So, I mean, that's why it's important. You got to go to people that know what they're doing, because if they didn't, she probably needs to be on maybe berberine to kind of help with the gut flora, or maybe some pancreatic enzymes to make sure she's digesting that food properly and taking out the pressure off of her pancreas. Because pancreatitis is one of the side effects that you could.
Rare, but you don't want to give it to anybody who has a history of that. But
absolutely.
Or if they get too nauseated, I'll switch them to tirzepatide if possible.
Absolutely, yeah. And then a lot of people do really well with that if they don't tolerate the semaglutide. So,
we go to every effort if you qualify to get your insurance to pay for this, but it's just not working very well. People get mad about it, and there's nothing we can do to tell your insurance company to pay for your medication.
No.
It's just impossible. But hopefully in the future it's going to get better.
I hope so. I think the more that we see how it's working, they've got to. Like, it doesn't make sense why we want to make people healthier when we have those tools in hand and we just withhold them.
Yeah, it's just kind of a shame in a lot of ways what our medical system is boiled down to. But So you need to think outside the box. You need to take care of yourself. Try to avoid getting sick, if you can, which means being a normal weight, moving every day, putting things in your mouth that's actually healthy for you, and reducing stress, getting a good night's sleep. And then when you reach a certain age, you need to start looking at your hormones. Most of what we do with you is really hormonal.
We do a lot of hormone therapy, and I've seen it make a difference in hundreds or thousands of patients, change their lives. Some tell me it saves their marriages. You name it. I've heard so many stories, but it's pretty incredible. They look everywhere for answers, and they go see somebody like Dr. Rogers, and they're like, well, let's do this panel, and they've never done it. They don't have a clue that their hormones are messed up, or their thyroid. I see people with thyroid issues. It's obvious, and they're like, nobody's ever checked.
They've been told that you had a normal TSH. You're normal.
5.
You're normal. It's just crazy how many. You don't want to be normal.
No.
On the scale we do today, if you're normal, you're one of those 2/3 of Americans that are overweight and tired and hurting.
Yeah, normal is not optimal.
No, that's a good statement. I like that statement. Anything else you want to talk about as far as compounding pharmacies? You can. It's, to me, I want somebody that has a license in the United States that is going to get this stuff sterile. As you know, compounding pharmacies kind of got a bad name from this one New England compounding pharmacy how many years ago that was,
I think that was
totally inept. And
2012, and they were not following proper procedure, and it was a bad situation. But we know better. I mean, they knew better then, but we know so much more now than we did then, and we have to go through testing every 6 months to make sure everything's good. There's so many guidelines we have to follow that the sterile compounding risk is minimal now, especially if you have somebody that's trained. But you may want to ask, be like, hey, if you go into a compounding pharmacy, how long have you been doing sterile? How long has the technician been doing it? The sterile technician that we have, she's been doing it for 30 plus years. She's 73. Yeah, she loves it. She's incredible. So you want to make sure that whoever you're seeing, like, they know what they're doing, they're trained, and they're following proper procedure. But they shouldn't be afraid to tell you that if you ask them. If they don't want to talk to you about it, then you probably need to find somebody else.
Always ask. Plus, nowadays, you have people that are on the internet. You can probably order anything off of there from China or India. There's no way I would do that and risk that, especially with like peptides or that type of thing.
Yeah, and most of that stuff is for research use only, which means they have not been tested. Like, it's just they're using it in lab research animals.
Especially if you're using an injectable. I mean, there's no way I would trust any of that.
Yeah, they haven't tested for endotoxins, bacteria. I mean, you could be injecting stuff you do not want under the skin, and then you bypass all your defenses. So it's there, and then at that point, it's hard to get rid of.
Yeah, it really is. Well, Randy, thank you for all the great work you do. Your pharmacy's beautiful, and you certainly helped us so much during COVID. And thank you. Thanks for coming on, Randy. We'll see you soon, and we'll see you guys next week.
All right, thank you.